After age 70, many of us rely on medications to help us live comfortably, whether it's for sleep, allergies, digestion, or chronic pain. These medications can be lifesavers, no doubt. But what most people aren't told is that some of these everyday prescriptions, especially when used long-term, might quietly affect how the brain ages. Recent research is shedding light on a connection that's too important to ignore. A 2022 study backed by the National Institutes of Health found that certain medications, when taken consistently over time, can double the risk of developing dementia in older adults. That statistic becomes especially concerning for those of us over 70, when the brain is naturally more vulnerable. Now, this doesn't mean you should stop taking your medication today. Far from it. What it does mean is that it's worth knowing which types of drugs have been linked to memory decline, so you can talk with your doctor about whether you still need them or whether there might be safer options now. Take Carla from Michigan. She's 73 and had been taking an over-the-counter sleep aid every night for more than a decade. It helped her get through long nights of restless sleep. But after reading that it might affect memory in older adults, she brought it up at her next doctor's visit. Together, they reviewed her options and switched her to melatonin combined with simple nighttime routines like calming music and screen-free time before bed. Not only is she still sleeping soundly, but she says her thinking feels clearer, and she wishes she'd asked sooner. Stories like Carla's are exactly why we're making this video, because once you understand how certain medications affect the brain and what you can do about it, you can take action to protect your memory and independence. Let's get started. Medication number 1, anticholinergics. Bladder, sleep, allergy, and depression medications. Let's talk about a group of medications many older adults take without realizing how they work in the brain. These are called anticholinergics, and they're used for all kinds of things: helping with allergies, calming an overactive bladder, improving sleep, and even treating depression. The reason they're concerning is because of the way they interfere with a brain chemical called acetylcholine. Acetylcholine plays a major role in memory and learning. Think of it like the brain's communication tool, helping messages travel smoothly between nerve cells. When acetylcholine levels drop, the brain has to work harder to process information. That's exactly what these drugs do. They block it. Now, a major study published in JAMA Internal Medicine followed thousands of adults over time. The researchers found that long-term use of anticholinergic medications was linked to noticeable brain shrinkage, particularly in areas important for memory, and a significantly higher risk of developing Alzheimer's disease. That's not something most people are told when they first start one of these medications. So what drugs fall into this category? One of the most common is diphenhydramine, found in over-the-counter products like Benadryl, Tylenol PM, and many nighttime cold or sleep aids. People often use it for allergies or trouble sleeping, not knowing it may slowly cloud thinking over time. Another one is oxybutynin, often prescribed for overactive bladder. It helps reduce bathroom trips, but may affect brain function after prolonged use. And then there's amitriptyline, an older type of antidepressant. It's sometimes still prescribed for mood, sleep, or even nerve pain. While it can be effective, its impact on acetylcholine is stronger than newer medications available today. The good news is, in many cases, there are safer choices. For sleep, doctors often suggest melatonin or techniques like guided meditation or deep breathing exercises. For allergies, options like loratadine, brand name Claritin, don't have the same effect on the brain. And for mood, many seniors do better with newer antidepressants like SSRIs, which don't interfere with acetylcholine in the same way. Let's take Harold's story. He's 76 and lives in Florida. For years, he took Benadryl every night to help him fall asleep. But he started noticing little slips, forgetting names, walking into a room, and forgetting why he was there. His daughter mentioned something she'd read about sleep aids and memory, so he brought it up at his next doctor's appointment. His doctor explained how antihistamines like Benadryl can affect brain function in older adults and suggested he try melatonin along with simple mindfulness exercises before bed. Within just a few weeks, Harold felt a shift. His thinking was clearer, and he didn't feel as groggy in the mornings. He still sleeps well, but now he feels better during the day too. There's nothing wrong with taking medications when we need them, but when new evidence shows that some may carry risks for memory and brain health, especially after 70, it's worth having a conversation with your doctor. Medication number 2, benzodiazepines, anti-anxiety and sleep medications. Let's turn to a class of medications that many older adults have come to rely on, especially for managing anxiety, panic attacks, or sleepless nights. These are benzodiazepines, and names you might recognize include lorazepam, better known as Ativan, diazepam, also known as Valium, and alprazolam, which goes by Xanax. They can work quickly and effectively, which is part of what makes them so commonly prescribed. But here's the concern. When used regularly over long periods, especially in older adults, these medications can change how the brain functions. Studies from both the NIH and Mayo Clinic have found that seniors who take benzodiazepines long-term have a higher risk of memory loss, confusion, and even dementia. These medications also slow down the central nervous system, which can make you feel calm, but that same effect can cause drowsiness, slower reflexes, and poor coordination. That's why benzodiazepines are also linked to a higher risk of falls in older adults. A single fall can lead to fractures or hospitalizations, and in some cases, long-term loss of independence. Joanne, 80, from Arizona, knows this firsthand. She had been taking Ativan every night for over 15 years to manage sleep issues and anxiety. Over time, her family noticed she seemed more withdrawn and forgetful. Simple tasks became harder for her to organize, and her balance wasn't what it used to be. After a long conversation with her doctor, she made the decision to begin tapering off the medication. The process wasn't instant. With medical guidance, she slowly reduced her dose over several months, while exploring non-drug strategies to support her sleep and ease anxiety. She started using a relaxation app in the evenings, practicing guided imagery, and keeping a consistent bedtime routine. Now she says her mind feels less cloudy. She still has occasional restless nights, but she feels more present during the day and more in control of her memory and emotions. Benzodiazepines are sometimes still necessary in short-term situations or during acute distress, but for ongoing issues, there are often safer and more sustainable tools. Approaches like cognitive behavioral therapy for insomnia, also known as CBTI, have shown excellent results in helping older adults fall and stay asleep without the risks that come with sedative medications. And gentle movement practices like Tai Chi or yoga can reduce anxiety while strengthening balance. The takeaway here is this. If you've been taking a benzodiazepine for a long time, or if you're caring for someone who is, now is the time to have a thoughtful discussion with your healthcare provider. There may be other ways to support sleep and manage anxiety that can protect your brain health for years to come. Do you take or recognize any of these medications? Let us know in the comments, and please like and share this video with someone it might help. Medication number 3, proton pump inhibitors, heartburn medications. Many older adults have been prescribed proton pump inhibitors, commonly known as PPIs, for relief from heartburn, acid reflux, or gastroesophageal reflux disease. These include familiar names like omeprazole, sold as Prilosec, esomeprazole, known as Nexium, and lansoprazole, or Prevacid. They're designed to reduce the amount of acid your stomach produces, which can bring real relief from uncomfortable symptoms. The issue isn't that these medications don't work. They do. The concern is how long they're used. PPIs are often prescribed for short-term use, but many older adults stay on them for years, sometimes without regular review from their doctors. That's where problems can begin. Research from Johns Hopkins Medicine has found that long-term PPI use may be linked to an increased risk of dementia in older adults. One reason is how these medications can interfere with the body's ability to absorb vitamin B12. This vitamin is crucial for brain function, memory, and focus. Without enough of it, the brain may begin to experience subtle changes that worsen over time. Richard, 78, from California, had been taking Prilosec for over 5 years. It started after a bout of persistent heartburn. He felt better within days, but never stopped taking it. Over time, he began noticing that he had to work harder to remember things. His daughter mentioned the possible connection between long-term PPI use and memory issues, and he brought it up at his next checkup. His doctor agreed it was time to reassess. Together, they created a step-down plan. Richard gradually reduced his PPI use, replacing it with simple lifestyle shifts. He cut out late-night snacks, avoided spicy and fried foods, and ate smaller portions. Not only did his reflux improve, but he also began feeling more mentally alert. He now calls it one of the most important changes he's made for his health. If you've been using a PPI for more than a few months, it's worth asking your doctor whether it's still necessary and whether alternatives like H2 blockers or diet adjustments might work just as well. Everyone's situation is different, but the goal is the same: protect your digestive comfort without sacrificing your brain health. Medication number 4, opioids, prescription pain relievers. Opioids have a clear role in medicine. Drugs like oxycodone, hydrocodone, and morphine can offer much-needed relief from severe pain, especially after surgery or during recovery from injury. They're also commonly prescribed to seniors dealing with chronic pain, including advanced arthritis or spinal issues. But while these medications ease physical pain, they can quietly affect the mind, especially when used over the long term. Studies from institutions like Cleveland Clinic have shown that opioids can interfere with memory, slow down thought processing, and create a lingering mental fog. Some older adults even describe feeling detached or unusually moody while on them. That was the case for James, 79, from Texas. After a hip replacement, he was prescribed opioids to manage the post-surgery pain. They worked well at first, but over time, his daughter began noticing subtle changes. He seemed forgetful, lost his train of thought more often, and wasn't himself emotionally. At first, they thought it might just be the natural effects of aging, but when she read about the possible cognitive impact of long-term opioid use, she encouraged him to bring it up with his doctor. Together, they worked on a new plan. James began weaning off the opioids with medical guidance. In place of medication, he added gentle movement, short walks on level ground, a bit of stretching, and later, Tai Chi. His doctor also recommended trying turmeric supplements, known for their natural anti-inflammatory effects. Within weeks, James noticed something remarkable. Not only was his pain more manageable, but his focus and sharpness had returned. He described it as waking up from a fog. It's important to know that pain management doesn't have to mean living in a haze. There are many approaches that protect both your comfort and your cognitive well-being. Physical therapy, aquatic exercise, heat and cold therapies, and non-opioid pain relievers can often provide substantial relief, especially when combined with nutrition and movement. If you or a loved one has been on opioids for a while, it may be time to talk to your healthcare provider about other ways to manage pain. The goal isn't to suffer, it's to find a balance that protects your independence, clarity, and quality of life. Let's take a moment to reflect on what we've covered. We looked at 4 common categories of medication that may quietly increase the risk of memory problems or even dementia, especially in those over 70. These include anticholinergics like diphenhydramine and oxybutynin, benzodiazepines such as Ativan and Valium, proton pump inhibitors like omeprazole and Nexium, and finally opioids, including oxycodone and morphine. All of these medications have their place in medicine. They're often prescribed with good intentions, to ease discomfort, treat symptoms, or support sleep. But as we get older, our brains become more sensitive, and what once worked well may now come with risks we didn't expect. This doesn't mean you need to stop taking your medications overnight. That's not what this is about. But it does mean that you deserve to understand what you're taking and whether there might be safer alternatives. That starts with a simple but powerful step. Make a list of every medication you currently take, including over-the-counter sleep aids and allergy pills. Bring that list to your next doctor's appointment and ask, are these still the best choices for someone my age? You might be surprised by how open your provider is to discussing better options. You're not being asked to tough it out without help. You're being encouraged to explore new paths that may protect not just your memory, but your independence, your energy, and your ability to enjoy the people and moments that matter most. What makes this empowering is that you're not powerless. You have choices, you have tools, and you have support. James, Carla, Harold, Joanne, and Richard all made changes that helped them feel more mentally clear and more in control of their health. Their stories remind us that it's never too late to adjust course. So ask questions, be curious, advocate for your brain the same way you would for your heart, your bones, or your eyesight. because every step you take to protect your mind is a step toward a brighter, more independent future. Do you take any of these medications or know someone who does? Let us know in the comments. Like this video, subscribe for more senior health content, and share this with someone who needs to hear it. You could change a life.